Doctors sometimes don't order the right therapy or the best therapy. Why? Sometimes doctors rely on their training that occurred in medical school, residency, or at a medical seminar. Those training sessions may have occurred years ago and are not up to date or are relying on old information. Secondly, sometimes doctors practice defensive medicine. Defensive medicine is when a doctor will order what is considered the standard of care in order to stay out of court and not get sued. Dr. Weston is on duty at the emergency department at Community Regional Hospital. He meets Aaron, a patient who is experiencing chest pain. Aaron is 45 years old with high blood pressure and no family history of coronary artery disease, the cause of heart attack. Through his evaluation and experience, Dr. Weston is confident Aaron is suffering an atypical chest pain that is not cardiac. But Dr. Weston is at personal risk if he sends Aaron home without evidence that supports his diagnosis. He knows that if Aaron has a heart attack at any point after leaving, he could be sued. So he admits Aaron to the hospital for overnight observation. The next morning, he orders a stress test for Aaron for the sole purpose of getting documented proof that the pain isn't cardiac related. Aaron finally goes home and the entire process costs $10,000, most of which was unnecessary. And Dr. Weston will be the first to tell you that this occurs in the ER almost every day.
Next year, 50,000 doctors will receive a letter stating, hey look, you've been sued. Once you've been sued, that will change the doctor's behavior from then on.
Another reason is because of insurance plans. Insurance companies give out what are called formularies or guidelines or cookbooks that tell doctors what tests, drugs, treatments, devices, and doctors they can order for their patients. If they don't follow that guideline or cookbook, they run the risk of being dropped by that insurance plan, or more importantly, the patient might have to pay out of pocket.
The cardiometabolic specialist will be unceremoniously dumped from United's Medicare Advantage network January 1st with little explanation. As United put it in a letter,
United Healthcare is amending your agreement referenced above to discontinue your participation in the Medicare Advantage network. This amendment does not require your signature.
Another reason why a patient might not end up with the best treatment is because they go to an expert or a specialist or a surgeon. If you get diagnosed with prostate cancer and see a surgeon, they're going to recommend a radical prostatectomy. If you go to a radiation oncologist, they're going to recommend radiation. Ultimately, at the end of the day, doctors rely on a combination of all of the above, plus instinct. They just go by what they feel is right. There is a growing epidemic in America. People are getting increasingly addicted to opinions. Opinions from experts, doctors, and celebrities. What is the difference between opinions from doctors and real evidence? Here is what you might hear when a doctor is giving you an opinion.
I think
I definitely would not. So much better than
my first suggestion is
it's very important.
I think.
Evidence, on the other hand, is the truth, what actually happened. The number of people who got a certain treatment and had a certain outcome. Let's say you're trying to decide whether to take drug A or drug B for a specific disease. An expert or doctor will give you an opinion such as, I recommend you take drug A because it's much better than drug B at curing this problem. Evidence will say, 40% of the patients who took drug A were cured, whereas 80% of the patients who took drug B were cured. Opinions will tell you what might happen. Evidence will tell you what actually did happen. Evidence is like entering a virtual waiting room where you can find thousands of patients just like yourself with the same diagnosis and the same medical history who have undergone treatments and see how many of those patients had a good outcome or a bad outcome. There are 3 ingredients in the recipe for best healthcare: evidence plus patient's preferences plus doctor recommendations equals best care. That will maximize the probability that you have a good outcome.
We need to score at least 814 runs in order to win those games and allow no more than 645 runs. It's about getting things down to one number. Using stats the way we read them, we'll find value in players that nobody else can see. And mathematics cuts straight through that.
Thousands of patients all over the world have used evidence to reverse a wrong diagnosis, to avoid an unnecessary surgery, to get the best treatment.
Anyone facing a new medical problem knows how confusing it can be to sort out the right treatment options. Many immediately seek a second opinion, which can be very costly. But as NBC's George Lewis tells us tonight, there's an alternative now, a service that will search the medical literature and report back for you.
Which sorts through all kinds of medical studies and reports on what it is that researchers are saying the best.
Your doctor can make some recommendations, but there are hundreds of studies out there that your doctor may not be familiar with. That's where doctor evidence comes in.
Inside every patient, there is a doctor, if they have evidence.